Well, the region has had one of the highest excess death rates in the world from COVID. That's a reflection of its, outside of China and Iran, it's starting in Italy, and also the older age structure in Europe, which has combined to lead to quite considerable death, especially in the first wave, but certainly in the winter wave of 2020, 2021, and then to a lesser extent, but still substantially in the Delta wave. So it's had a profound effect on mortality. It's had a profound effect on health systems, exposing critical gaps in health system capabilities, and has demonstrated, I think, the critical needs for surveillance and public health capabilities to respond to threats like COVID and future threats that may come along. If you look at the indicators and what the future trajectories suggest, we see real progress on a number of them. Child health has continued to improve. Non-communicable disease mortality has been going down. There's been progress on reducing suicide up until a few years ago. And you can see across the indicators generally a picture of progress. There are a few exceptions. For example, HIV incidence has gone up in the region, not down. And then there are examples where for some risks, we have been making very slow progress in the last 5 or 10 years. Alcohol is a good example of that. In terms of the forecasts that reflect these factors that are combining to drive them forward in the future, some of the things that bring behind the scenes, bring attention to, for example, is obesity, which is helping slow probably in the future some of the progress on cardiovascular disease, as well as slower rates of progress on tobacco, slow rates on alcohol in the coming years. So a number of factors that warrant attention. Another one where we would expect perhaps faster progress, and it's now slowed, is maternal mortality. There are a number of surprises in the report. I think one of them that comes through to me is the rising incidence of HIV, and then the trajectory around what that looks like. The sort of lack of progress since about 2016 in alcohol consumption and what that might mean for the future. The very slow progress in reducing tobacco consumption that we expect to see in the reference scenario, that as such an important risk factor is clearly a challenge. And the basic slow pattern of progress on some of the poverty-related or income-sensitive infectious diseases like tuberculosis, where even though there has been real progress, a 50% reduction since 2000, the forecast suggests that we're entering a phase where progress will be much slower. Well, we're very excited to be working closely with WHO Euro. We've worked, behind the scenes very well and hard, we believe, on COVID together. And what's exciting for us is that WHO is the premier organization giving advice to ministries of health. And if the quantitative analyses that we are able to help provide to the regional office can aid in that critical policy dialogue, we see that as a tremendous opportunity for us to contribute to more informed decision-making in the region.